And welcome everybody. I am Sam Coffman. I'm here with Kyla Helm, and we are introducing this course, Botanical Functional Medicine, Spring 2019. This is, you'll notice the slides that I've used. If you started in this course in starting in January, in early January, I think it was January 6th, then you've probably seen these slides. I use this as an introduction. As I explained in that slideshow through the syllabus of the course, what we've done is expand a 12-week course to a 15-week course, and basically we're repeating the first 3 weeks, but adding in some elements that are a little more advanced in weeks 4 through 6. So in other words, the first 3 weeks are there, which are existing right now. We're really in week 2 right now. They are there to allow people to be able to catch up on an herbal, either in the herbal medicine side or on the functional medicine side or on the nutrition side, to be able to see where you may be lacking a little bit as we pick up. Because once we get started in technically week 4, things are going to be picking up a little bit. And by the time we get to week 6, week 7, things are going to be moving along at a pretty good pace. And I want to make sure that everybody is caught up and doesn't have to go backtrack and try to figure out herbal terminology or nutritional concepts that they didn't get before, those kinds of things. So that's why we've expanded the course. And I think everybody is going to appreciate that to some extent, because it's a little less intense, a little less pressure to catch up to where we all are on pretty much the same sheet of music when we start out, because we do have a really diverse group of students in this class, from people who are clinical herbalists but don't really have any orthodox medicine training, to vice versa, to people who are just have some nutritional background but nothing else, to some people who really don't have a lot of background in any of these areas. Anyway, I have with me now Kyla Helm, and I'm really pleased to be able to introduce her. And Kyla, I'm just going to shut up here and let you talk a little bit about yourself and what this course is for you, and take it away.
All right. Well, hello, everybody. So my name is Kyla Helm. I am a traditionally trained MD. I am residency trained in functional or in family medicine, and about 12 years into my career, sort of made a career change, stumbled into functional medicine, and that's what I've been doing for the last 14 years. I ran into you, Sam. It's been about 8 years, I think, 8 or 9 years ago, and started to incorporate herbal medicine into my functional medicine slash family medicine clinic, and have gotten to the point now where there's just simply things I can't heal without herbal medicine. And so Sam and I have been talking for years now about trying to put this course together where we blend our two areas together, because we know that the overlap is tremendous between how Sam thinks about healing people and how I think about healing people. But there's obviously, he knows more about the herbs, and I have maybe a better understanding of labs. I don't know. But we thought, well, we bring it all together, and so that's what this course is. And I'm super excited because I think I've gone to lots and lots and lots of functional medicine training, and they touch on herbs for sure, but nothing goes into the depth that Sam does. And I think that just makes our ability to heal people so much better if we can blend these two together. So that's me. That's my background and kind of how we got to this course.
Yeah, and it's you certainly do have. I mean, you don't have to be modest about it. Kyla has an immense amount of experience, far more than I do in the realm of clinical medicine. Of course, that's what she's been doing, and so it's really I'm very honored and very pleased to be able to offer what I can to kind of fill in the gaps. So plant medicine, as we work with it here, has a lot of different aspects to it that I think you have to incorporate. You can't just go out and say, I know that many of you know this, but you can't just go out and say, I'm going to take a plant and I'm going to substitute it for the pharmaceutical I was using. It will not work that way. You have to have a deeper understanding of the plant medicine itself. I have a couple of plants here that I didn't intend to have a talk about necessarily or have meaning, but just looking at them as Kyla was talking, it's like the couple of plants that I picked that I had good pictures of from my own garden. One of them here is Tacoma Stans, which is our yellow bells or Esperanza as it's called, and the other one down here is a version of Mahonia. It's Mahonia bielii or leatherleaf Oregon grape, and both of these are herbs that we use a lot. We, meaning myself and Kyla, use a lot in formulations for these chronic epidemics that we have in gut health, poor gut health, and pre-diabetes issues. Tacoma stands is excellent at being able to help lower blood sugar, especially post meal blood sugar, and be able to be one of the many different herbs and one of the many different techniques we can use to try to level out people who are just in this pre-diabetic state that affects all of the different systems we're going to be talking about this semester, with the pancreas and the thyroid and the adrenals. And so we can do something about these issues, looking at it from the standpoint that we're going to get to in just a second here, with the combinations of herbs like this together, or working with maybe 5, 6, 7 different herbs in a formula. But that is by no means going to substitute in the standard way that I think most of Western Orthodox medicine, and Kyla can I don't want to speak for Kyla, but I think she would agree with me. Western Orthodox medicine, as it turns to herbs, in functional medicine, as it turns to herbs, there's this kind of overwhelming idea that it's a pharmaceutical, and that we approach it the same way we do pharmaceutical medicine. Hey, you used to take this particular pharmaceutical. Well, hey, now why don't you try this berberine pill? And there's no comparison between the effectiveness of that and the far superior effectiveness of being able to formulate and work with these multiple systems using herbs. And they work so well together that way. And that's really the secret. That's kind of my secret that I'd like to try to help people with. And the years that I've taken to get there, to try to save you time and all the mistakes that I've made, and the kind of the bungling from here to there, to figuring out what works best in the clinic. What do I have the best feedback from and follow up from over years and years of working with this and with different clients, thousands and thousands of cases, to be able to say, look, don't waste your time with that, go with this. And so that's what I hope to be able to give you in an herbal side that's going to be different. I feel like it's going to be a lot different than if you just went to, say, a functional medicine seminar and they were talking about herbs. I think one of the advantages that I can offer is that I have forced myself, by virtue of the fact that I walked away from med school, and I didn't get any of the licensing that I needed to, and I just basically turned my back. In a way, I had a hard time doing it, but I turned my back kind of on orthodox medicine, pharmaceutical medicine, and forced myself, not only in our first world environment, but also in very developing nations and places where I had no choice, forced myself to work with hundreds of clients a day, with hundreds of people walking into the clinic a day, or 800 a day at least, up to 100 a day, I would say, with herbal medicine only, nothing but herbal medicine, ranging from infections to just standard, some of the standard things that we're working on that are chronic illnesses now. And I think that really gave me an advantage, because I didn't ever rely on anything else. And sometimes to the detriment of the results, that they weren't as good. And it's like, okay, you got to turn. We need help here on the orthodox side. We need some pharmaceutical help. But honestly, that's probably less than 10% of what I've had to ever do, way less than 10%. So I feel really strong, really positive about what I'm able to give you. And I think Kyla does too, because she's worked with me, and we have these cases we can present and show you what's worked. And so that's just kind of I feel like a little overview of where the herbalism is really going here.
I would throw in one piece. So I think if you're coming at this from a conventional medicine standpoint, so you're a nurse or a doctor or a provider of some kind, we have this thought that this group of symptoms means this disease, and that means one pill, and certainly that doesn't work. And what I found, as Sam and I have worked together, and he comes up with these formulas, is he might be addressing in 2 or 3 herbs, is, say we're talking about infection, so it's anti-infection, but he's also putting in there to support the liver, or to support the enterohepatic circulation, or to support the immune system. And that just doesn't happen when we tease out one piece and make it a pharmaceutical, or even one herb. And so that's why I think the formulas work so well. And Sam and I have lots that we use together. And again, I can't, I'm running out of my herbs right now, and I'm not sure what to do with my patients because I don't have them, that sort of thing. And so I think it's taking a different approach. We look and we say, wow, there's more to it than just this infection. We need to stimulate lymph drainage, and we need to stimulate and support liver in order to get them to clear this infection. And we can do that with herbs very nicely. So I just want to throw that 2 bits in. Go ahead, Sam.
Yes, great. And that's a good segue, I think, into really the purpose of this course. how are we going about doing this? And this is the first time we've offered this course. And so like any course, the first time we do it, or anybody does it the first time through a course, there's going to be a lot of things that probably change over the course of doing it. And so we might have started out with way more material than we're able to give in 15 weeks. I don't think so. I think we're about right because I've been doing this long enough and Kyla's been doing this long enough. I think we probably hit the right amount of material to keep everybody very, very busy, but at the same time not to be overwhelming or to feel like we're cramming too much in. But we within that context, there's a lot of stuff we have to do. We have to at least introduce functional medicine and introduce these frameworks and all of this. And I'll let Kyla talk about the functional medicine side. I've already kind of talked about the botanical medicine side. So just so if this is the first time you're seeing this, the first time you've logged into the class and are looking at this, you will notice that I do have an entire introduction to herbal medicine for beginners course that you can take, and it moves pretty fast, but it's very basic. And I think for somebody who has very little botanical medicine background, please go through that and fast forward through stuff you already know, but stop for a second and listen to the stuff that's there that's useful to you. And because once we pick up and start going around week 7, I want to be able to make sure that I'm not going to lose anybody on that. And so that's the introduction portion. And then the framework is really all the functional medicine framework. And I'll let Kyla talk about that then.
Well, and Sam, did you include my what is functional medicine piece as part of the introductory?
Yes, it is
Is it
in
in
there.
there?
It is in these first 3 weeks as well. That's correct. In the first week, actually.
Well, anyhow, I'll tell. And so, in a sort of in a nutshell, what's functional medicine? It's really it's medicine that looks for the root cause of why we get sick. And I always tell people, I'm like, you think intuitively that's what we do in medicine. That's what your doctor does when you go see them, but that is not what we do. We measure a blood pressure, for instance. We see it's high. We diagnose you with hypertension, and we give you an antihypertensive medication. That's what we do. We don't say, well, why did you get hypertension? Did you get hypertension because you're chronically stressed? Did you get it because you have a toxin? Did you get it because you have an adrenal problem? Did you get it because you have a hormone problem? We're not asking those questions, generally speaking, in conventional medicine, and functional medicine does. It's the why. The why did this happen to me piece of medicine. And so that's one thing. And then the second is we look at things that at least conventional medicine, not botanical medicine and Sam's medicine. We've talked for years about how do you not think about balancing hormones, for instance. So in functional medicine we look at your stress, chronic unresolved stress. We look at nutritional level, not just what you're eating, but how much are you able to absorb, and what is how much are you overusing. So what is your nutritional status? We look at gut function. We look at toxicity level. We look at, am I missing? I'm missing, Sam. Hormones, nutrition, toxins, gut, stress. Anyhow, it'll come to me. But we look at these things every single time a patient comes in there, and I think that's very different than what we do in conventional medicine. So that's the kind of what is functional medicine from my perspective. So
Right. Yeah, and I put up that fundamental slide there talking a little bit about it. So these are the lectures that Kyla specifically talks about
yeah.
all of these.
So the fourth one down, functional medicine, that is just an overview of what it is and how we kind of hook it together from a systems biology approach. That's in that lecture. So that'll explain it in a lot more detail.
Right. So in the first 3 weeks, you're going to get everything all the way up through, I believe, through epigenetics, and then we start moving into the following, drug-induced nutrient depletion, nutrient deficiencies, and common tests. Common tests are going to be something that you're going to see starting in week 4. We'll start bringing that in because I want to make sure by the time we get to week 7. Let me go ahead and fast forward one more slide here and start getting into some of these bullet points here that you're already familiar with these common tests. And there's not, testing is not, medical tests, blood, urine, saliva, feces, whatever tests that we're doing are not, they're not rocket science in the sense that it doesn't take a lot to learn how to work with them and to read them, really, once you learn it. But if you're not familiar with them at all, it can be a little daunting. It feels like it is, even though once you get familiar with it, you probably say, oh, I got that, and you can get it pretty quickly. So I want to make sure that people are comfortable with that. So when we start doing and presenting some case studies, and you can say, when you're doing your maybe work with Carol on in the study session that she's offering, you're able to say, okay, well, what are the test results? What I'd like to see is test results for this and this and this. And I want you as a student, by the time we get to about week 9 or 10, to start being able to say, hey, well, I'd like to see these test results, and then that way you're thinking ahead already in your assessment, your diagnosis, and you'll be able to say, this is what I would expect in your head. You should be saying, this is what I would expect to see with this, and this is what I would expect to see if it were that. And some of those things take a little bit of, you have to do it a few times, and sometimes more than a few times, especially with certain things. I mean, I think some people get kind of overwhelmed by thyroid, for instance, and T3, free T3, and T4 and TSH, and where all of those pieces fit together. If it's this way and this is high and this is low, then what does that mean? What are the what are those possible things? The same thing maybe with cortisol. As you start looking at free versus cortisol metabolites, what are you looking at, and what does that mean? And these have specific meanings, not only that Kyla can give you an immense amount of information about in terms of the functional medicine side, but they also make a difference in terms of what herbs we would consider in many of those cases as well.
I would just throw in there too, if you're a healthcare provider or somebody from the conventional medicine side, just take a look at those tests, because so for instance, the ranges that I would consider optimal are probably different than what you and I were taught in, say, medical school or residency, because in functional medicine, we're trying to optimize our body and our biochemistry, where in conventional medicine, we're often just waiting until we're sick in order to start acting on that. So, for instance, a lot of people will say, a glucose level of 100 is normal. We know that that's not normal. We know that we need to be below 90. And so, I just tell you that, as, we tend to say, oh, I know that, I've been looking at labs for a long time. And you might want to just look at the levels, because they often are different than what you're used to seeing.
Right. There's a lot more subtlety to it, as what I've found, in my, of course, I don't have a lot of experience with labs anyway, but as I've worked with you, Kyla, I've noticed that there's a lot more subtlety. There's a lot more, the
Right.
numbers are different. Yeah.
Right. Well, and I'll look, and I have it the way that I wrote it in my slides is, hey, this lab is trending high. It's not high yet, but it's trending high. And if you look at that lab in association to these other two labs, then you have a better idea of what's going on. So even if you just look that particular lab in isolation, you might not think too much about it. But you combine, these other things that are also trending high, then you know that person is heading down the wrong path. And then we can turn them around much more quickly than if we wait until full-blown diseases set in. And that's, obviously everybody's goal is to become unhealthy to begin with. And we can see these markers far, far ahead of time if we're looking at A, the right ones, and B, we're setting them at optimal levels.
Right. Yeah, and so leading into that, I think the way the course is set up works really well, and really this is largely thanks to Kyla that the course is set the way it is, with these introductory these pieces that we're back here working through some of the groundwork, and then getting up into some of the different micronutrients, and as we work through even common things like fatigue, to slowly lead us into this concept that you're going to get in systems biology back in weeks 1 through 6. You're going to hear about the systems biology concept and breaking down the organs into systems of triads that are not necessarily set in stone and completely are not functioning all by themselves. Of course, nothing functions in a silo in our body. We know that. But if we can look at things in regards to these triads, it's really helpful. And it's something that really works well with the herbal approach as well. And so I've talked about this for some of you who've taken my wound and infection management course with herbs. And of course, I've given pieces of that course all for years and years and years now. And I've talked many, many times about how, even if you take a WFA, I talk about how that kind of that 4 stages of healing, that particular approach or that particular paradigm to understanding how the body heals, say from a wound, is a very handy one to work with herbs with. And it's not that it's really kind of, like most things with the Western herbalism, I have to be honest with you, we piggyback off of other systems. That's the concept of the eclectic herbalism going back, a couple centuries, is that you're taking a piece from this and you're taking a piece from that, and you're taking, maybe some indigenous medicine and maybe some folk medicine, and that you're trying to check out and see, okay, why does it work that way? Maybe some energetic medicine from TCM or Ayurveda or traditional Greek medicine as you look at, current trends in America. And then, of course, the biomedicine, the kind of botanical medicine that's out there that can get very reductionist very quickly, but taking pieces of that. And so in the spirit of that, really this triad piece is another one of those things where, sort of like wound healing stages that fit really well, that we can kind of superimpose an herbal paradigm over. This is another one of those. And so I'm a big fan of using what works, and working with it, pragmatically. How do we step forward, working with sort of a chance to be able to evolve, Western herbalism in the West. And I think that this is a great way to do it. So I'm excited to be able to do that, to kind of superimpose my own version of how I go about working, or clinically with herbs, which is my own version. Those of you taking my classes, nobody else teaches this. I'm the one that I did this. I didn't take it from somebody else. You're not getting a recycled version from Michael Moore or anybody else. As much as I have respect for all the other great teachers of herbalism over the last over the 20th and into the 21st century, this is my own thing, and it's something that is born of really of 30 years of just working and pragmatically figuring out the best way to approach this, working through and working with clients, and going into the kind of the Western biochemistry side, and then coming back out into more of the energetic, or just the side of the fact that this is living medicine as well, right? So my point was that all of these things start to lead up into those triads, and the triad includes the adrenals, includes the thyroid, includes the pancreas. And I don't know if there's something that you want to say about the triads briefly. Anyway, Kyla,
No,
you
I
get
think the
into.
only thing with this, so the triads, as you said, I mean, I always tell people they layer, right? I mean, we we have adrenal, pancreas, thyroid, gut, brain, immune, um, liver, lymph, kidney, so on and so forth. And what I find clinically is that people come in and they might have this multitude of problems, like seemingly just everything wrong with them. And if you kind of drill it down, you find one or maybe two triads that seem to be most out of balance, and then but then the more one triad gets out of balance, the more another one, and so it layers on there. So it's never just one, but this particular triad, adrenal, pancreas, thyroid, in the United States right now is a mess, and it is our fatigue, brain fog, weight gain group of people. If you had to dumb it down to just a few things, that's it. And there's very few of my patients that don't come in complaining of, I don't think my thinking is not clear, I can't pull words out, am I just cloudy, or I'm tired, or I'm gaining weight. I mean, it's like everybody has these problems, and so this is just a great place to start with them. And a lot of the stuff that we're going to be recommending from a functional medicine standpoint is lifestyle. They've got to change their diet, they've got to exercise, they've got to clean their environment up, they've got to help their body get rid of some of these toxins that were around all the time, because it's leading now to these organ dysfunctions that we're seeing as things like fatigue. But unfortunately, you walk into fatigue in the regular doctor's office, and if you don't have cancer, anemia, or thyroid dysfunction, overt thyroid dysfunction, you're told to go home, that there's nothing wrong with you. And so now we can dig into this a little bit further, and as we get into the mitochondria and that kind of stuff, which I think falls into this triad, which is why I put it here, I think you will be able to help a tremendous amount of people, at least with part of their stuff. And because we're so focused on lifestyle with this particular triad, it's going to help other triads that may be overlying them as well.
Right. Yeah, I think it's definitely, I mean, we talked about this many times, but this is the place, really the most potent location to start with the triads. And like you said, this is the epidemic that we see here, the fatigue and the weight gain and it's just, and the stress plays such a role in this too. I feel like working with and understanding how stress plays into our lives, there really almost needs to be an entirely different set of words outside of just the term stress, that people start to become, the vernacular of people, of everybody, just understanding, because the word stress has so many different meanings and overtones, has been used and in so many different ways over the decades, that it almost doesn't really mean anything to a lot of people anymore. But the way that we stress our bodies, from everything from the posture that we sit in and the way that we don't breathe, that our lack of being able to breathe correctly, to the fact that we sit all the time, to the fact that we expose ourselves to the computer, on many people for daily, every single day, all the time, or the phone, to just the constant, basically uncompensated stress that goes on in our lives, family and travel, traffic, and all the things that happen that are totally uncompensated, regardless of whether you have a strong and a healthy exercise plan or not. So all of those things, these are kind of emerging, epidemic, symptomologies that I think are coming out of this changing world. And if you went to go back 100 years, or from now, or go back 200 years, or whatever, pick a time and a space on this planet, you would have an entirely different set of epidemiological, triggers and symptomologies that you would see over, say, a certain percentage of a majority percentage of people coming in for healthcare problems. Totally different. It would have nothing to do with what we're seeing today, right?
Well, keep in mind that we as humans we have been introduced to 85,000 new chemicals in our environment that human beings have not had to deal with ever. So we're sort of this big experiment on what that's going to do to us long term, right? And so, combine that with food that's nutritionally poor, and we've got ourselves a brand new set of sickness that probably you didn't see in 100 years ago, and certainly when I travel, I don't see, when I go to Africa, I don't see it there at all. So we have to deal with that here because we are a country of plenty. We are a country of plenty of stress and plenty of everything else that's leading to these diseases.
Absolutely. Yeah, exactly. And, the places, that's a great point. If you go to Africa, or, we've done our trips down to Nicaragua, and depending on which side of Nicaragua you're on, and what group of people, if you go and you're in the working with the campesinos in on the western coast that are standing in sugarcane fields 6 days a week at least, 10 hours a day, in these, like you're saying, Kyla, the toxins, the pesticides, and the all of the fertilizer, and all that, in the water that's ankle deep, all day long. It's just epidemic. And it's males, the males that are working out there, the amount of kidney disease down there. I mean, even MINSA, even the Minister of Health in Nicaragua, has admitted that something like 70% of all males had kidney disease in some of these areas, right? So you can't tell me that's not toxin related, right? And so you're right. We have, there's a different set of kind of symptoms that you're going to see, and illnesses that you're going to see in any given culture. And even in America, of course, you could break it down. You go to Native American tribal lands, you're going to see a totally different set of symptoms a lot of times. In people living in these food deserts, you go to poor areas in the urban area, and you're going to see some things that are going to probably be the same from city to city to city as well.
Right. And I think that if you don't address not just, oh wow, I've got a toxin, but how do we support, we do liver and gallbladder support all the time, right? And so we have to consider those things. And I think, unfortunately, right now in conventional medicine, it's not even a consideration. It's not there yet. So, and this is where herbs are outstanding. They do great things for supporting those functions.
Absolutely. Yeah. I mean, that's really where herbs shine, right? Is to support the functions of the body, that, just help the body do what it already does, but help it to do it better.
Right.
Yeah.
Right.
Yeah. So we can talk a little bit about how the course is set up here. We have one thing that you're going to see in this course is going to be case studies. And do you have some stuff you'd like to say about that, Kyla? Case studies.
So I don't know if we put them on there, but I've got several case studies. I don't know if you're using them or not, Sam, because some of them I hadn't even met you, and I was bumbling away in my beginning of functional medicine, but even just doing simple things, made people better. Had I had those people now, I would love to know, hey, I would do this, that, and that. I'd put them on this herb or that herb or whatever. They would probably gotten better faster. But I think probably one of the very best ways to learn and to start to understand how you put these pieces together is to actually have cases, and whether that's cases that we present and we can talk through how we would manage them, Sam and I, and or maybe ones that you guys even bring to the class and we can discuss as a class. That would be great too. But I think that is by far the best way to start understanding how all of these pieces fit together, rather than listening to me drone on with slides. So I think that the case studies are going to be paramount to making all of this start to make sense. So I don't know
Yes,
how you want that to run, Sam, so
exactly.
you can talk on that.
No, that's true, and yes to all the above. So we have cases that are earlier cases for you, Kyla. We have cases that are the cases where both of us have put in, I've worked with, and there's that input, and then I have cases that are strictly mine as well. And so this is a chance for us to continually reintroduce, and it's not necessarily. I don't look at a case study as being something where we say, okay, this is the case, that happened, and this is what we did, and they got better, and everybody says, yay, this is what we do every time we see that. Every case and every human being, of course, is going to be different. But really, the purpose of case studies is to say, okay, in this case, this is what I want you to do. I want, rather than just presenting all this information to you, I want you to ask for what you think, or to put input into that. And that's why we have the study sessions with Carol, which are sort of like a round table to some extent. And that's also why we'll hit on those on the Q&As. Maybe not the first Q&A, but by the time we get to the second Q&A, Kyla and myself will be reviewing some of those case studies as well as part of the Q&A. And that's a better way for those questions to come out than just for somebody to say, hey, on slide such and such, I didn't quite understand this or that. Not that you can't do that, but I feel like, case study really gives you more context to be able to ask these questions and to get answers and to remember this information with.
Well, and I love when we have a group. I love groups of people, lots of minds coming together, because they might say, well, Kyla, you did this and this. Why didn't you do that? And I might say, well, at that time, I didn't know about that. Or, wow, I didn't think about that. That's great. Because, when you, at least from a functional medicine standpoint, when I start with somebody, I might be looking at them thinking, wow, they've got a gut problem and a hormone problem and a toxin problem and a nutrition problem, and where do I start? And I always just say, let's just start. Let's start somewhere. Maybe it's diet, maybe it's gut, maybe whatever. There isn't a right or wrong answer. It's not like grand rounds where you're going to get shot down if do something that is not in a particular order. There isn't, and the more people that can come together, the more I think that person, if they're a real person, or if they're somebody that we could do something with, would benefit from that. So I love having group discussions about cases, because things come out that you just never thought. Maybe you're blind to that, or you just didn't think of that, or whatever. So I think it'll be educational for me as well, I think. So
It always is. I agree. When we do our roundtables, I usually pop in and say, okay, this is what I would say, and I'll usually come up with a protocol that's based on, or at least a context, a table context for a protocol. These are the 3 or 4 or 5 things that I feel like are really important to hit. And of course we can base our protocols off that, and how we would dose and all that stuff off of that once we figure out what herbs we would use for that, if that's what we're doing, right? And inevitably there's going to be students that are there that are going to have come in from other schools or from other backgrounds, maybe not so much even schools, but just other backgrounds in healing modalities. We'll say, well, what do you think about this? Or usually more emotional or psychological or energetic aspects to it that I don't really have an experience with. It's like, well, that sounds great. And then that usually spawns a conversation with 2 or 3 other people who may have more experience in that area. So I think it's a good chance for everybody to learn from each other as well. That's always good. I always learn from my students as well. This is never, and like you, Kyle, I think it's what makes you a great teacher, is that you're never the kind of person that says this is the only way to do this, and if you do it any other way than what I'm saying, you're wrong. Go out, finish my course, and then go out and figure it out on your own from there. But anything but mine is wrong. And it's quite the contrary, and that's true of both functional medicine, but certainly of herbal medicine is there really is never one way to do anything. There never is, and there never will be. We're not made that way, and plants aren't made that way. It's living medicine. So.
I agree.
Okay, so that's our case study thing, and then how we're running the quizzes are every 3 weeks, basically, all the way up to week 15. So week 3 quiz is coming out then at in about a week and a half, I guess. It'll come out near the end of each week, and everybody have a chance to to do it over 3 or 4 days before the next week starts, and it'll just basically be a chance for you to be able to put things together. The quizzes are not meant to be something that starts hammering people and weeding people out and hammering people down. I don't like teaching that way. I feel like quizzes and even exams to a certain extent, are aside from the obvious to test what your knowledge is, are also a chance for you to really learn the information. Because when you have a quiz, you can't just forget it. You can't just pretend like that information isn't important. You have to answer a question, whether it means you're going to have to go and do some research, or going to have to go back and listen to lectures. It's a chance for you to really put that together. And so I feel it's very important. A final exam, of course, is an exam, but it's like anything on an online course. You're going to be able to take your time and look things up and go back and look things up as well for that. And then finally, the last 2 things here are live Q&A. That Kyla and I are leading through every 3 weeks as well. And this gives us a chance to kind of review. And like I said, we'll start introducing some cases probably by week 6, maybe week 3. We'll see. But I really, the way I have the cases organized, I have to talk to you a little bit more, Kyla. We'll get that and make sure we've got them kind of distributed in a way that fits with the format of the course now that we've changed it a little bit. But we'll of course go through cases, but also it's a chance for you to really talk to us and pick our brains and give us information that that we may not have thought about and talk about together and figure out maybe an answer to something that we hadn't considered. And then Carol is our TA for this class, and she will be taking group questions and discussions over the what I'm calling assignments. There aren't going to be any assignments that you have to turn in for this course. There's going to be enough to do as it is. I feel like getting through this, and I know that most of the people, the vast majority of people coming into our school, are people who have, they have a working life. They're people who are usually have kids, they have families, they've got a life outside of school. They're not full-time students per se, like somebody who's young and doesn't really have anything other than burgeoning future student debt over their head. And so I understand that. And so I don't want it to be something where you've got to sit at home and you've got to work for hours on an assignment. But what I do want to do is be able to put out some of these exercises, I would rather call them, where you can look at them, kind of can think about them, and then get together in the study sessions with Carol and go through and sort of fill out. Some of them are things that you need to fill in that are part of what you learned, in the functional medicine mostly type stuff. Maybe some of them will be things that you fill in that you learned in some of the herbal stuff that you're going to be getting starting about week 7, week 8 in here. Okay, that's mostly what I had to say about this. Kyla, is there anything else that you would like to say?
I don't think so. Yeah, it's exciting. I think it's going to be a great class.
I agree. I'm really excited about this. So for those of you who are hearing this that have not started the class yet, or you maybe haven't even signed up for this yet, that's fine. That's why we have this first 3 weeks that are kind of this startup period, the slow startup period. So the course technically really opens and starts on January 27th. And even if you sign up a little bit late, a week or 2 after that, you still could get up and running, especially if you already have a background in some of this, in at least one part of this. I would say you'd have no problem jumping into this even 2 weeks late if you had to. That's the nice thing about online courses. You can get up to speed pretty quickly. So for those of you who are hearing this, this will be a podcast that we'll probably put out through a couple different places. For those of you hearing this who haven't signed up, come and check us out and you can come to our website here. I'll put it up here. And the place to find us would be either thehumanpath.net or .com. We'll get you there too. But when you go to the Human Path, you will have to go to the navigation bar and click on the herbal medicine there. But that'll just take you straight to our website that is specific for all our herbal classes, and that's herbalmedics.academy. So herbalmedics.academy will get you there, and then on our calendar below, you'll see it. It's right up near the top. You'll see the Botanical Functional Medicine course, and that's where you'd want to sign up. So hope to see you there, everybody. And for those of you who are already in the class when you're hearing this, welcome to the class, and we will be talking to you more over the next 15 weeks. Thank you very much, Kyla.
You're welcome. Thanks, guys.